Hi, good morning. This is Dr. Farley, and today in this vlog, I want to go over two pretty interesting articles. They were in Epoch Times. One, it says scientists may have discovered a way to prevent at least half of all cancers. And then the next one says, by the way, that was published June 27th, 2022. And the next one says you can switch off your cancer genes, and here's how. So I think I'll start with the first one about scientists may have discovered a way to prevent at least half of all cancers. So the way that I always view any diseases is that these are not mistakes, that these are intelligent adaptations from cells that are under high levels of stress, either from physical, chemical, or autosuggestion type stress. Okay, so in this paper that they may have discovered they may have discovered a way to prevent at least half of all cancers. What they end up saying is that many cancers are caused by chronic infections. Imagine that. And let me take it back a second and just ask you, or just explain this to you, that 85% of everyone's immune system is in the gut. What comes through the gut? Your food. So, in general, what you want to know is that your pathogenic load will be determined by the health and the strength and the adaptability of your body, mind, soul, and spirit, and whether it is integrated and working well together or disintegrated. And over a time frame, one of the manifestations of that may be cells not working properly. You may get a lower immune response, and then you can start to get high pathogen load. So almost everyone with chronic infections, whether that's Lyme disease, sinus infections, urinary tract infections, bronchitis, whatever it may be, there's a compromised immune system. So in here, there's a virologist out of Harvard named Professor Hausen. He won the Nobel Prize in 2008 in physiology or medicine for his discovery role of the papillomavirus, and saying that there's a good chance that you can lower your risk of cancer by 50% if you were to lower your pathogen load. But that also, it's not just about killing bugs. Always keep this in mind. It's always about the adaptability of the system. And what we do basically is look at body, mind, soul, and spirit, and a reintegration so that the system can adapt and work at the highest level possible. The other thing that they did was they did some research out of Germany, and what they found is that there's a new form of infectious agents called bovine meat and milk factors in dairy products and bovine sera. So it looks like that these bovine meat and dairy products and bovine sera, blood, contain a lot of germs and pathogens that you may be getting, and in a weak system or a system that gets overloaded, meaning I just keep eating it and eating it and eating it, and where I'm a baby and some silly person tells you that you shouldn't breastfeed, and instead you're going to be giving your baby dairy or some other kind of a formula, then many of these cancers can be formed by viral, bacterial, or even parasitic infections. So that's the point of this. I have read this in the past also, that places with the highest intake of dairy had very higher risks of cancer. This goes back into the 70s. So I've seen that before. This bovine meat and milk factors called BMMFs. There's over 100 types of viruses. Okay, so wow. So these are contaminated food products when we're getting them. One more thing also, is that if you eat a lot of dairy and meat, and also most people are having major essential fatty acid imbalance, and another major cause of cancer is not just these viruses, but being stuck in a chronic inflammatory state. A chronic inflammatory state. 85% of everyone's immune system is located where? In the gut. So that's where chronic, there's no such thing, by the way, I want to clarify this. There's no such thing as chronic inflammatory state. There's sustained inflammatory states, meaning we're doing something to sustain it. The immune system just doesn't decide to stay in chronic inflammation unless you're doing something to irritate it on a regular basis and sustain it. So we also must look at infections, but we also must look at a chronic inflammatory state. And you can measure in various different ways, and we do very in-depth measurements of people's immune systems here. You also want to know that if you're intaking these dairy products, listen to this for a second, that infection by these BMMFs in patients' toddler years through milk consumption can set them up for breast cancer later in life. Can you imagine that? Can you imagine if people knew that you're giving your child dairy-based formula early on, which is contaminated with over sometimes 100 viruses, and that down the road, again, an accumulation of root functional causes, an accumulation of stressors will break the system down and may turn into cancer, breast cancer down the road? They also found many different types of estrogens in milk, which can promote breast cancer. They also found that if you're going to have milk, whole milk is better than 2% skim milk or buttermilk. So if we can reduce these BMMFs, which means no dairy and less meats from that source, and we can reduce sustained inflammation, that we can have a positive impact on bringing down cancers from colon, breast, lung, prostate, stomach, and ovarian. I also thought this was pretty interesting. So now preventing cancer. Well, we talk about reducing inflammation. And in this paper here, what do they want to use? Anti-inflammatories. I mean, it's really ridiculous to me. How about we understand basic functional immunology, that our immune system starts in the gut, and that for our immune system to respond properly, we need to identify foods that work or don't work specific to us. We cannot go on to these anti-inflammatory diets because it may not be specific to us. We've got to go to someone that is an expert in food, and apparently these people are not. So they start talking about taking aspirin and COX-2 inhibitors, and oh my God. So we have a chronic problem. By the way, one more thing. There are no drugs required for health. You do not need anti-inflammatory drugs to quiet the immune system. You need to understand how it works. And that's a very complex idea. But your immune system that's being stuck in sustained inflammation is not there from lack of Advil, lack of aspirin, COX-2 inhibitors. What else did I talk about in here? Anti-inflammatory drugs. I mean, it's just really crazy. But they did say this, that by lowering inflammation, you can reduce the risk of colon cancer by 63%, breast cancer by 39%, prostate cancer by 39%, and lung cancer by 36%. So here we go again. Chronic sustained inflammation is a major cause of cancer. High pathogen load is a major cause of cancer. Both of those usually mean that we have an improperly functioning immune system. You're immune compromised, and 85% of the immune system goes back to the gut. And what comes through the gut? The food. We must pull back and look at body, mind, soul, and spirit, how the system works. Is it adapting properly? Am I in an integrated state, a disintegrated state? And what can we do to restore normal function? Let's stop treating disease. Let's stop looking at inflammation and using the word chronic and just telling people, oh, just take 2 aspirin. It's crazy in my mind. So we must look at causes and by looking at causes, root functional causes, we must look in body, mind, soul, and spirit, and we must figure out what are those root functional causes, correct them for each individual person, allow their system to restore a higher level of integration and adaptation, and not be worried about these processes. Cancer is a sign that someone is completely broken down. Many times we can have many of these problems being passed along from generation to generation, whether that's a body problem, a mind problem, soul problem, or a disconnection, a disintegration, can be coming from generations passed down. So thank you very much. If you have any questions, please let me know. And as always, God bless you, God bless your family, and God bless the United States. Thanks.